Also, we're going to have our doctor with CHI St. Vincent Diabetes and Endocrinology Clinic joining us to tell us more about nodes, thyroid nodules.
Right.
Yeah.
Sometimes people say nodes when they're talking about thyroid nodules, and she'll tell us about this. How serious can they be, and can they be a precursor to throat cancer?
Yeah.
So we'll find that out, and what you should do if you think that you may have that.
Working for you in the spirit of Arkansas. This is Channel 7 News. Good morning, Arkansas.
When we come back, up next with Dr. Kumar, more about thyroid nodules. That's next. Well, here's a little lesson. Your thyroid is located at the base of your neck, just above your breastbone, and it can sometimes develop nodules, which are solid and fluid-filled lumps. And today we're going to visit with Dr. Saumya Kumar from the CHI St. Vincent Diabetes and Endocrinology Clinic to talk a little bit about thyroid nodules and what they can mean. Good to see you.
Hi.
Yeah, hi. So where is it, kind of?
Your thyroid is right in the middle of your neck.
Okay.
If you keep your hand and swallow, you can feel it moving.
Okay, everybody doing that? Okay, what are nodules then that develop there?
Nodules are small, round or oval growths that can develop in your thyroid gland. About 10% of normal people can have it without any problems. But in about 5 to 15% of cases, this can be cancerous, and that's why it's important to get these evaluated.
Okay, very good. What are some of the predisposing factors to it being cancer, possibly?
Women are more predisposed to have nodules rather than men. Also, if you've had a family member that has, a history of thyroid cancer, or
Genetics.
there are certain genetic syndromes that run in your family, you are more predisposed. Also, an important factor is radiation to the neck for any other reason. Those people are more predisposed.
If you have had radiation in the past to your neck for another reason.
Yes.
Are there symptoms of it? Do you know you have it?
Most of them are asymptomatic. What mostly happens is maybe a doctor or a nurse would find them in your neck while doing a routine physical exam, or maybe you got an imaging done of the neck for another unrelated condition, and then they are incidentally diagnosed.
Okay.
But they can be big, and if they're big, they can cause symptoms like feeling difficulty, difficult to swallow, or feeling like a choking sensation in the neck.
So you can feel them if they're big enough, I guess.
Yes, yes.
Okay, then you would evaluate them to decide if they're cancerous or not. How do you do that?
So basically, we want to make sure that if they're benign or cancerous. And so we would start with a thyroid hormone level. And if the thyroid hormone level is high, then usually these nodules are not cancer. If this is normal, the thyroid hormone level is normal, then we would do a ultrasound of the thyroid in the clinic and determine if these nodules are suspicious for cancer. And if they are, then we would do a fine needle aspiration with a small needle and take some sample, and we do this in the clinic under local anesthesia.
Okay.
And then make sure that that's not cancer.
And I said some people say nodes, but that's a different thing entirely, right, than nodules?
Yeah, nodes are more lymph nodes, which are basically outside the thyroid gland, and nodules or cysts in the thyroid is something that's concerning for cancer.
Okay.
So.
And then how are they treated once you evaluate a nodule?
So if they are small and benign, then we can just follow them by periodic ultrasound, maybe once a year thyroid ultrasound. But if they are big, causing symptoms, or if they are cancer, then the thyroid will need to be surgically removed. And in case the thyroid hormone levels are high, then we do something called a radioactive iodine treatment is how they're treated.
So many options there to discuss with your doctor if you do find one. Well, like she said, most are benign. Most are not even noticed by the patient. It's found by the doctor. But if you think that you've had trouble swallowing or any of these symptoms, then you probably want to go ahead and have it checked out. We need to put up the information for CHI St. Vincent, the Diabetes and Endocrinology Clinic, right there on North University. There's the number, 552-4763. Or if you've had a history of this in your family, you may want to go have it checked as well. It's always good to be safe. Thank you, Dr. Kumar. Good to see you. Thank you for driving down here in this mess today as well.
My pleasure.